Good afternoon. Happy Thursday, everyone. Thank you for being with us today. I am honored to be joined by my colleagues, Commerce Secretary Stephen Pryor and the one and only Major General Chris Callahan from the Rhode Island National Guard. Both of these gentlemen are truly valued colleagues who have been working through this pandemic with me and the team since day one, and I'm honored to continue having their support and presence with us here today. So I'm happy to stand before you today and report that Rhode Island continues to be in a very good place when it comes to our overall COVID-19 response. And it's important for us to take a breath together and really look at the full landscape of the situation that we have before us. Over the last 24 hours, we have made more than 10,000 appointments to get people vaccinated at 2 new centralized mass vaccination sites in Rhode Island. We have effective treatment for COVID-19 getting administered throughout the state every day. We are still leading the nation in testing, and the data situation, as you can see right now on the screen, and we'll dig into a little bit more, is better than it has been in months. So testing, treatment, and vaccination, it's our comprehensive package. We've talked about those being the tools that bring us through the final components of this response. And look at our data. This is a key component. This week, our statewide percent positivity decreased again, this time from 2.8% to 2.2%. The number of cases in every city and town in Rhode Island was below 300 cases per 100,000 people last week, and we saw a decline in case counts and percent positivity for all age groups during this time. Specific to yesterday, we had 320 new positive cases out of 17,924 tests for a percent positivity of 1.8%. For context, before we got our pause in place around the holidays, the end of last year, this percent positivity number was close to 10%, and it is now 1.8%. That is critical. Similarly, our number of current hospitalizations is 180, down from around 500 people hospitalized on days in December. And our daily hospital admissions are down 46% since just last month. These kinds of results are not by chance. When we look at the full picture of where we are in Rhode Island, we have to acknowledge that they are directly attributed to some of the very targeted and strategic decisions we have made as a state over the last 2 months. And they are directly attributable to the patience, the partnership, and the sacrifices made by people such as yourselves throughout Rhode Island. Again, the patience, the partnership, and the sacrifices. So I want to thank you. It does pay off in that bigger picture. Our overall goal is to steer this so that we get to have a great summer together here in Rhode Island. We are positioning ourselves very strong for being able to do that. During our last 2 press conferences, Secretary Pryor announced some incremental changes we were able to make in response to our data trends. If you recall, he announced some changes for bar areas in restaurants and for houses of worship and venues of assembly. Today, in continuing that, I am very pleased to be able to announce some updates to restrictions that have been in place for visitation in hospitals and long-term care facilities. Today, we will start with hospitals. You may remember that in March of 2020, we released hospital visitation guidance in response to COVID-19. And you may remember that this guidance used a 3-level approach to visitation. Effective tomorrow, we are allowing hospitals to return to level 1, which is the least restrictive level. The hospitals will still be asking you to work with them to minimize the potential spread of infection and ensure the safest environment for patients, staff, and visitors. All hospital staff, patients, and visitors must continue to practice the 3 W's: washing their hands, watching your distance, and wearing your masks, the most effective masks we have. Hospital visitors will also have to be screened for signs and symptoms of COVID-19 upon entry, and we have provided hospitals with guidance on other measures they must take to ensure that visitation is happening safely. However, while hospital visitation today is largely limited to support people and family members during end-of-life situations, I am so thankful to say that that will not be the case tomorrow based on what I was just able to share. To be clear, visitation is not just going back to normal because we have to still take significant precautions like mask wearing and continuing to get screened upon entering, but it will feel a little more like it did before these higher level restrictions went into place. I want to caution that it is still important for you to work with your loved one's providers. If you are sick or becoming sick, it is still best to forego making visits to vulnerable ones in the hospital. To keep everyone safe, we will still need to be cautious and rely on the clinical judgment of your clinicians, physicians, nurses, and the staff who are caring for your loved ones. Similarly, for nursing homes and assisted living facilities, we are very happy to announce that effective tomorrow, visitation should resume if the facility has not had any COVID-19 cases in the last 14 days. If a facility identifies one case, the facility should adhere to the quarantine and isolation guidance currently in place. If a facility identifies 2 or more cases, they should contact the Rhode Island Department of Health. At that time, our team will consult with the facility on next steps when it comes to visitation. We have issued updated guidance to long-term care facilities with additional details, including guidance on how to make sure that ventilation is as good as possible, and to continue to follow the rules on mask wearing and screening and hand washing. Restricting visitation was a very important measure to protect vulnerable Rhode Islanders and our healthcare system. It was done to protect the people we love. But without a doubt, it was one of the most difficult, heartbreaking choices we have had to make in the last year. I want to take a moment to really acknowledge the stress, the sacrifice, and the pain that limited visitation has caused to patients, residents, families, and the staff caring for the patients. We know that this has not been easy, and we truly thank you. I also want to thank all of those staff at these facilities who have made tremendous sacrifices. We are extremely grateful, and we're pleased that our data is in such a component of this response now that we're able to move forward with opening visitations. I'm also grateful that we have a nation-leading testing program here in Rhode Island. If you are going to be visiting your loved ones in hospitals or nursing facilities, you should commit to getting tested once a week. The capacity is there for you. We are encouraging that to happen. It's easy. We have test site access across the state, and many of them provide test results within 15 minutes. Importantly, with a new strain of COVID-19 identified in Rhode Island, the best way to protect your household is to get tested regularly, wear a high-quality mask, and continue to follow the guidelines that we are issuing. Over the next 2 weeks, we will be distributing more than 400,000 KN95 masks across the state. Even if you don't have symptoms, go get a test and get a mask. Doing these two things can help you protect your household. We'll be giving out those masks at the testing sites across the state so that you can get your test and get your mask at the same time. So we've talked about testing. We know how important treatment is. This is the chance now to move on to our vaccination campaign. The initial portion of our vaccination campaign was focused on healthcare workers, such as the people who work in our hospitals and the people who live and work in our congregate settings. We focused on our congregate settings because we have seen the majority of our unfortunate fatalities. Close to 70% of all our COVID-19 associated fatalities have been from our congregate living settings. And we focused so heavily on our healthcare workers because we are in a pandemic and we need our healthcare workforce intact, protected, and ready to go. With us now having identified one of the more contagious variants of COVID-19 in Rhode Island, we feel even more confident in this decision that we have made with vaccination. Our early, targeted, deliberate focus on these populations that I've talked about is one of the reasons why we feel a little more confident that we can loosen restrictions on visitation in these specific settings. As I shared earlier, Rhode Island has made great progress with our COVID-19 numbers. As you can see on the slide being displayed now, when it comes to daily hospitalizations, which is the metric we focus on most closely when thinking about reopening the economy, we have made more progress than the rest of the country just over the last month. We have also made more progress than the other states in our region. While the hospitalization rate in Massachusetts declined by 32%, and the hospitalization rate in Connecticut declined by 10%, ours has declined by 46%. Rhode Island's progress has been even more significant in those areas where our vaccination efforts have been concentrated. If vaccination report cards focused on this particular public health outcomes, hospitalizations, Rhode Island is ahead of the pack. For example, we have seen a 49% decrease in cases between January and February in the general public. That decrease has been even more pronounced among healthcare workers and among residents of long-term care facilities. Again, the groups that we focused on in a very targeted way with our vaccination rollout. To be clear, there are other factors in play beyond just the vaccine. Mask wearing and social distancing are huge, and we know that treatment with monoclonal antibodies is having a big impact, as intended. Also, the fact that we have worked so hard to make testing so accessible in all different settings throughout Rhode Island helps us identify cases right away and get ahead of any large clusters. But there is no doubt that our vaccination strategy is meeting the main objectives of the first portion of our vaccination campaign, which was to protect people in our nursing homes and other congregate settings, and to ensure that we have a healthcare workforce so people are here to provide the care if you or your loved ones were to need it in our healthcare systems. It's also clear that the targeted strategic approach of focusing so closely on certain populations has been operationally complex. We understood that. We had a limited supply. We needed to get it to these specific populations so we could have the greatest impact the way we have, but it has also taken time. It is much faster to administer doses at a central mass vaccination site than it is to bring vaccine to people where they live and to coordinate vaccination through someone's employers, like we did with healthcare workers. For that reason, when it comes to our administration rate, as opposed to the decrease in hospitalizations that we intended to see, we are a little behind some other states that have not been quite as targeted. So other states did not have the drop in hospitalizations that have allowed us to now be able to move forward with opening up visitations and to feel confident that our most vulnerable populations are protected. But those other states were able to get administration going of the vaccine faster. I understand why people are watching the administration rate in Rhode Island and in other states. That makes sense. It's important that we all center ourselves around understanding the data and understanding why, for Rhode Island, we chose the approach that we chose. We are trying to prevent hospitalizations. We are trying to keep people alive and prevent fatalities. And we are focused on getting the economy fully open again as soon as possible. At the end of the day, we will measure our success based on health outcomes. How effective were we at keeping people out of the hospital? How effective were we at keeping people alive? And I know that's what matters. That's what matters most. All that said, we've heard the feedback loud and clear, and we agree. We are there. We understand what the concerns have been. And so we said we, by and large, achieved what we needed to with phase one, and it is time. It's time with our phase two to get our vaccination shots administered more quickly. We can be confident in the fact that the most vulnerable, those who really suffered the most, are protected enough. And it's time to get vaccines out to as many people as we can, still going according to the risk layout that we have shared previously: age, underlying illness, and geography, but going significantly faster. That's why we were so excited to launch our 2 mass vaccination sites this morning for the general public. One at the Dunkin' Donuts Center in Providence, and one at Sockanosset Crossroad in Cranston. General Callahan and his amazing team at the Rhode Island National Guard and people throughout our response team in state government have done an amazing job getting these sites up and running and getting up to 3,250 appointments made for day one just today. We have 10,352 appointments booked already for over the next week and a half. Right now, people who are 75 years of age and older can try to make an appointment to be vaccinated at one of these 2 mass vaccination locations. They can go by visiting vaccinateri.org, or if you cannot register online or are not as comfortable doing that, we also have set up an automated phone line to help with registering that way, and you can call 844-930-1779. Because of our understanding and the need to move quickly, on Monday, people who are 65 years of age and older can also start trying to make appointments. There are limited appointments available, so if you're not able to make an appointment, you should continue to check back over the coming days. Many of the cities and towns are focusing on their oldest adults first. So if you are in the 65 to 74 year age bracket, your best bet is trying to register on one of the 2 state-run sites or going through your local pharmacy. However, again, the eligibility timeline is the same throughout the state. We are very excited to be launching these new sites because these are high-volume vaccination clinics that are age-based for the general public, meaning that vaccine will get administered there much more quickly than vaccine for specific populations at the various different locations the way we had approached with phase 1. So we recognize what we did took time. We were effective in what we did during phase 1, and we know it is critical to speed up the process and get us going with people being vaccinated. And we have the capacity to do that through these large vaccination sites, as well as continuing to build out the pharmacies. As we look forward, our 2 objectives are continuing to get faster and get simpler. So what does that look like? We're focused on that. We understand it's time. As I said, running the mass vaccination sites will mean many, many more shots administered per day. We have the capacity to do hundreds of shots per hour at these sites. This is our model. More shots at fewer and more central locations. We envision standing up additional state-run mass vaccination sites over the coming weeks in other parts of Rhode Island. We also envision consolidating the clinics being run by the cities and towns to about 5 regional sites run by cities and towns. I really want to acknowledge the cities and towns have done phenomenal work doing outreach and getting their most vulnerable residents to local clinics. Similar to our phase 1 approach of being targeted and strategic, our cities and towns have really contributed to making sure that we have been effective in reaching those 75 years of age and older. Some of them have been registering for them, getting access to them, helping them get to the sites, working with the senior center to help ensure that our seniors, 75 years of age and older, have what they need to get vaccinated. That was important. We want the cities and towns to continue that local focus while also beginning to collaborate on our planning for regional clinics so that we can, over time, get more efficient as a state, which is what our goal will continue to be here going forward, continuing to get faster and continuing to get simpler. We are so focused on having fewer sites, because that's going to be key to getting faster and getting simpler. It allows us to cut down on the redistribution process. Redistribution is the number 1 reason why it takes time to get shots into arms. When we started this vaccination campaign, for phase 1, when we knew we were being strategic and targeted, 14 days was the goal we had in mind for being able to get from the beginning when we first order the vaccine after being allocated from the feds to the end point when a vaccination shot goes in someone's arms. We mapped it out and we said that around 14 days is the time taken to get us through that point. Those 14 days included us receiving the vaccine at a central site after it's been ordered and shipped by the manufacturer, coordinated by the feds. It also included then breaking down the vaccine into the right quantity for the proper vaccinator and then repackaging it again, all while meeting the vaccine's shortage and temperature requirements, some of which were complex. Then it involved us shipping the vaccine out to the proper vaccinator in Rhode Island. At times, that was one of the many municipalities, towns, and cities who has done a great job getting to our 75-year-olds. The vaccinator receiving the vaccine then had to work on scheduling someone for a clinic because, as I've said in the past, given our COVID approach, unlike what we had during the H1N1 pandemic response, you can't just set a time and have large groups of people show up during that time to get vaccinated. So taking the time to schedule it. And then the vaccinator administering the dose, which is often at a clinic scheduled over a few days, would then take place after the vaccinator received the vaccine. Most of our vaccine is getting administered within that 14-day window. However, we know that it's time to get faster. We are purposely moving to that point of getting faster. The way we do this is by getting out of that redistribution business. We move from having that strategic targeted approach with multiple different vaccinators and partners and consolidate, streamline to a smaller number of sites that have the capacity to receive and store large amounts of vaccine. With that, we can make it so that the vaccine is shipped directly there from the manufacturers. When we take that redistribution step out of the process, we cut the timeline in half, from 14 days from beginning to end when the shot is administered to 7 days or fewer. That's what our goal is. As we consolidate our vaccination sites, we will be consolidating and also simplifying the registration process. So we started out purposely with multiple partners so that we could really get to our most vulnerable population and make it as easy as possible for them to get vaccinated. But we also recognize that that was at the expense of causing confusion. We understood that feedback about it being confusing to have multiple registration systems right now. While the pharmacies will always have their own registration system because of how that was required to be set up in partnership with the feds, we have a single registration system, one website, and one phone number for the state-run sites. And our goal is that when we consolidate our multiple municipal clinics that are focusing on 75-year-olds, once that is complete over the next several weeks, in time, those clinics will consolidate to just 5 regional clinics. And those appointments will also be available through the same centralized system that we have set up at the state level. And so there will really, between the 3 channels, just be going through pharmacies or going through our one centralized website or phone number single registration system that's run by the government. One other note I want to make about our vaccination campaign, and that's on equity. We have had a focus throughout this response on getting resources to the places who are hardest hit. We have talked a lot about the impact of COVID-19 on Central Falls, for example. For that reason, Central Falls was a place where we got vaccine out early. Roughly 20% of adults in Central Falls have gotten at least a first dose of vaccine. Since we started vaccinating there, case rates have decreased in Central Falls by 71%. And our test positivity has fallen from 22% to 5%. This is fantastic news. However, we know that we have much more work to do in some of our other harder hit communities. The good news is we have a template of what can work. Very rightly, people have pointed out that many of the communities where our vaccination rates are the highest are not the communities that have been hardest hit. We want the vaccination rates in every city and town to be high. But we also know that we need to catch up in some of our other more densely populated communities where there are higher rates of hospitalizations, particularly among certain zip codes. We know that, we're focused on that, we own that, and we have that as a major priority in the short term so that we continue to see the outcomes and the decreases in the disparities and the gaps that have been known throughout the pandemic response. With that, thank you, everyone, and I'll open it up for questions.
Maintain that your approach was more strategic and could have been slower, but how do you explain, while focusing on those high-risk groups, that there's so much unused vaccine that seems to be the focus of why Rhode Island's response has been slow? Why couldn't you have realized that there was an extra supply that could have been moved out quickly? I guess there seems to be a disconnect as to, okay, we took this approach, but why is there so much left over?
Yeah, I'm glad you asked, because it allows me to connect the dots on what I was explaining about our redistribution process. The vaccines that have been noted as or considered unused or on the shelf were not held back in any way. They were part of this distribution and redistribution process that I explained that happened over the course of that 14 days. When you have multiple partners that you have to get vaccine out to, it takes the time of packaging and then repackaging and getting it out to the right city and town, getting it out to the right hospital provider, getting it out to the right other partner that we have with vaccinating. And in some of those situations, because we did a good job in minimizing waste, which also takes time, we have wasted 0.2% of vaccine. So that's almost negligible. Usually you aim for keeping it below 5% or 10%, and it was at 0.2%. A big part of that is because after we would distribute, if vaccine had not been administered, we would collect it back and then redistribute it to another entity that we could. And when you have multiple partners, that was taking time. You have to package it right, it has to be stored appropriately. That is what contributed to that sort of inventory of distributed or redistributed vaccine that made it seem as if it was sitting on shelves, but it was really in that pool of vaccine that needed to go back out. Now that we're moving to a faster approach, we will not have that pool. And as soon as the vaccines arrive, they will be able to go. And we're trying to make it so that the vaccines go directly to these fewer number of central mass vaccination sites.
Wherever it was in the system, I think the criticism is that it wasn't going into people's arms. And that, I know Harvard that gave Rhode Island an F, that was the thing. Well, the best thing to do is to get it out there.
Yeah,
so
it did eventually go into their arms. When you looked at the 14-day time frame, almost 100% by the time you got to that 14-day mark did get into arms. It wasn't as if it just sat there and never got there. It just was that process of getting it to the different sites, and that's too long. That's why that grade came through that way, and we acknowledge it was a way to get it to multiple partners, but it also took longer. So we achieved what we needed to, and we no longer need to stay with that. We have to get quicker. Shrink that time from 14 days to at most 7 and make it even less than that if we can have the vaccine shipped directly to the sites where it will be administered.
Does this mean there's more now? There's some sort of surplus that you can now flood into the mass vaccination sites on top of what you're getting per week? Is there that extra? I guess the disconnect is there an extra supply sitting there that can now go in right away?
As we cut back on the number of vaccination sites and go more towards a fewer number of centralized sites, we will have more vaccine that's able to get pushed out into the community because they're not getting redistributed to one of the many sites that were out there. Our goal is by the end of February that any of those that were in that circulating redistribution process, because of the large number of sites that it was being sent out to, will be almost negligible, because we can either have vaccines go directly to sites or significantly minimize or decrease the number of times we need to redistribute vaccine.
Was any portion of that a mistake? terms of how that whole redistribution system was going and the slowness of the pace?
Yeah, I mean, it was part of we didn't expect it to be measured as that slow, but we knew logistically, in order to achieve the targeted approach we needed to get at the individuals who were highest risk, it just literally took that time to be able to do it carefully and effectively. We accomplished what we needed to. We recognize you cannot continue this entire response doing that. We got the largest drop in hospitalization rates, and it's time to speed it up. And thanks to our partnership, we have the capacity to do that. We already have 10,000 plus people who have appointments in place, and you will see that continue to get accelerated, that number continue to decrease.
Doctor, we understand that folks who are going to these new clinics that open up today are signing up when they're 65 and older, in addition to 75 and older, and are getting vaccinated. Is that a mistake? Is that part of the plan? Is that good or bad?
We recognize that when our messaging was put out yesterday about the sites opening up, it might have been somewhat confusing because we said 75 starting today and 65 on Monday. So with this being with the first 24 hours of opening, we want to, give people the benefit of the doubt to know from now till Monday, it's 75 and older. We want to get as many of our 75-year-olds and older into our large vaccination sites and to continue with our municipalities, as well as have the opportunity in our pharmacies. And then on Monday, be able to start scheduling 65 and older. So we're giving people the benefit of the doubt, but we will, if we need to, and have the capacity to, delete appointments if they are made by individuals continually who do not qualify. So we want to keep things moving as much as possible. Focus now on the 75 and older. If a few people didn't really realize and tested to say that they are 65 and got through, we'll, finish that process, but over the next 24 to 48 hours, not have that be the primary flow throughput. We want our 75 and older to be able to get vaccinated between now and Monday.
When will that change? They're signing up now. I mean, everyone who's 65 and older is signing up now. The system allows them. Some folks in Providence is advertising that 65 and older can get vaccinated. Is this practical? I mean, how are you going to manage that? And what is the cutoff when you're going to start kicking 65-year-olds off that have signed up today? How does that work?
Yeah, so there are two different elements that are in place. We do have the ability, if it's overwhelming that people 65 and older starting now are vaccinating, we do have the ability, if we need to correct that between now and Monday. It's a short window, so we're gonna go carefully there. We really want to message for 75 and older between now and Monday to be able to take advantage of those appointments, and we can make that correction. Separately, we have our high density community strategy, where there are specific zip codes. Central Falls was our starting one. We have 2 to 3 zip codes in Providence and in Pawtucket, where we are working with them, similar to how we have done in Central Falls, to be able to start to move forward because the rates there are higher, and part of that strategy has involved additional ways to get them vaccinated. So that might be some of what you're hearing in Providence if it's one of those zip codes that we have planned to focus on. But by and large, for the main group, 75 and older now through until Monday, and then 65 and older across all channels starting Monday.
I'll toss this question out to you or Secretary Pryor. Has the governor explained to you why, to many Rhode Islanders, she clearly considers her employment security more important than an orderly transition of government to a McKee administration? And when does she plan on resigning?
Can certainly reach out to her office to be able to share that. Let's see if
of the administration. You've always been the only representatives of the ongoing active administration. So We're asking you, since it's clear that Governor Raimondo didn't want to take the time to come today, and Lieutenant Governor in waiting McKee isn't here either.
I can share, certainly from my perspective, that Governor Raimondo has been fully engaged and involved in our process. We've worked closely with Governor Raimondo as well as with Governor McKee, who we continue to meet with on a daily basis. So from that perspective, I can say that it is continuing forward. It's a unique situation.
Reported as hearing about significant appointments through the media. That doesn't speak to me to an ongoing involvement. The months of listening to Lieutenant Governor McKee talk about his inability to be involved in ongoing decisions doesn't speak to an involvement. I don't know if there's ever been a real involvement. Is it time for Governor Raimondo simply to resign and allow an orderly transition of government to take place, in either of your opinions?
I can confirm, as can my colleagues, that there has been regular involvement given the meetings that we have had on a daily basis. The change that was shared was one that has been part of the process and the leadership of our COVID unit. We have shared that with Lieutenant Governor McKee this week as it's rolling out. The position is starting early next week. That is a normal part of the transition and engagement. We're continuing to interact multiple times a day.
Doctor, let me follow up on that. Governor Raimondo kind of quietly extended her executive order to March 17th, probably long after she's going to be gone. And given everything that you said, the 2%, hovering around 2% infection rate, the hospital rates are down, all those things we talked about a year ago that you wanted to keep under control. I assume you had some type of input. She asked you, should we continue this executive order? Did she ask you? Mm-hmm. Okay. And so what did you tell her from a science and data perspective that we really need to keep this executive order for another month, maybe long after you're gone?
We have been concerned.
Emergency order, I'm sorry, the executive order.
Yeah, we have been concerned about the variant, the new variant, and wanted to make sure that we have an understanding of how this significantly more contagious variant will impact Rhode Island. We recognize that as decisions are made about executive orders, at any time, based on the data, we can make updates to those changes. As we are sharing incremental loosening of restrictions each week, we are making updates to executive orders each time we're doing that. So that's a process that will continue. We're going to continue to understand how the presence of this new variant in Rhode Island impacts us. And similar to how I expressed today, thankfully, that we are loosening restrictions on visitations, we hope to continue to be able to go that way as long as we're continuing to be effective in our overall approach with testing, treatment, and vaccinations.
Order seems to trump. Just hang on a second. That emergency order seems to trump some common sense. I got an email from a parent. URI was supposed to play Bryant. I mean, can you imagine at the end of February? Probably the only people going is a parent. And that game got canceled, but URI is going to start playing now. And I don't know if this is coming from the university or from you, from the Department of Health. Why couldn't somebody sit outdoors, take it outside, and watch a game in February when the government says you can't do that? Why is that?
Yeah, I cannot speak to the specific scenario that you're referring to. We do have guidelines that allow for spectators to be in place, and we're continually assessing, particularly with the consistency of our data trends, given our overall positive response, how we can make improvements in loosening. That's something we're looking at on a regular basis.
And just one final question. Would you continue to describe Governor Raimondo's handling of all of this as brilliant?
Absolutely. She is a brilliant individual and leader. She has continued to be engaged directly with us. Thank you for your questions.
Dr. Alexander Scott,
She's here.
Can
Yes.
you please explain to us what the appointments will look like if somebody under the age of 65 registers for a vaccine at one of the mass clinics? Even myself, as a 24-year-old, was able to go through the entire process, put my real birth date of 1996 in, and I got a confirmation email, which I was able to cancel. but still, there are people that still want to go book an appointment, and they can through this system. Will they be turned away?
Yes, so we have this system established, similar to the way other states are doing. In order to go faster and simpler, the system is based on the honesty and cooperation of the people involved. There is an ability to self-attest to your age and who you are. Hopefully, for between now and Monday, only those who are 75 and older are doing that. Thankfully, as you went through the process, you canceled it. We do have the ability to, on the other side of it, cancel the appointments or delete them if we have individuals coming through who are not within the eligibility criteria. We know that this was a lot of information that just got started, so we're giving people the benefit of the doubt. But we look forward to building this out based on trust and cooperation of the people who are involved so that we can have this move as quickly and as simply as possible.
Why isn't there just an age
Instead of
filter?
people showing up to these mass clinics and saying that I'm not under the age of 65, or I am under the age of 65, you will just be deleting their appointments and communicating that with them ahead of time before they go to these clinics.
Right, we have the capacity to do that.
One follow-up question to that as well. Is there any updated plan on people who are homebound right now? How are they getting vaccinated through the state?
We are continuing to work through the process of having a home care entity be able to engage with those who are homebound. We've also worked with our municipalities, given the availability there. We need to continue to advance on some of the planning there because it is a priority.
When will there be news on that?
We'll circle back with you next week with that.
Doctor, I have two questions, one for you and one for General Callahan. The first, the state's targeted approach was designed to cut down on deaths, but January was the third deadliest month so far, and there have already been 120 COVID deaths this month. Has the approach cut down on deaths, and if so, how do you know?
Thank you for that question. We understand that fatalities lag to a certain extent in terms of the impact. So we are anticipating that, similar to the cases decreasing and the hospitalizations decreasing, that will happen for fatalities as well. We need a couple of extra weeks to be able to determine that, and then would be able to respond accurately from that standpoint.
General Callahan, I have a question for you. If you can come to the mic, please. Governor Charlie Baker said that they were informed last night there would be significant delay in this week's vaccine shipment because of the weather in the South, and that he was going to be sending some of his National Guard to pick up the vaccines themselves. Do you plan on doing that? What's sort of happening here?
Yes, so we have no news on that. There's been no news to us relative to any type of delays that we're concerned about, and if it does come to fruition, then the team will get together and we'll get after it. Very confident that we can duplicate what Massachusetts is doing if we're needed to do it.
He said they're coming out of Tennessee and Kentucky, but for right now, Rhode Island hasn't.
Right now, we have not heard of any delays just yet, prior to coming on stage.
Dr. Alexander Scott, why don't you put an age filter on the sign-up? I think you're relying on the honor system, but unfortunately, some people either may not know they're supposed to do that, or some people may take advantage of it, and then meanwhile, you have other people in the whatever the next up group is that are waiting, and people may be jumping them. Why not just put an age filter on it?
We do have that in terms of people being able to put their date of birth from that attestation standpoint. We will continue to explore all forms of technology in a way that can support even further as we go, but we wanted to get it going first. This is similar to how other states are doing it from that self-attestation standpoint, and as we go, we'll continue to explore and implement additional ways to support the work we're looking to do.
Massachusetts, the website crashed when they went to wider eligibility. On Monday, will the state website here in Rhode Island crash?
We have done everything we can to help ensure that the website will continue to function effectively on Monday. Today is a great test of that to help reassure, because we've had over 10,000 already sign up and we're doing well. So we are pleased with that thus far, and each day it's an assessment to help ensure it stays that way.
Yes, we've heard from a lot of senior
folks who don't have internet, who are using the phone line to make their appointments and they can't get through. As more and more groups become eligible to register, is there a way that the state is improving that phone line? I know it's automated, but are there ways to improve that?
Yes. We made changes already today to improve it by going from automated to adding live individuals on the phone line to be able to help. And we're continuing to monitor it several times a day so that if we need to add additional vaccines to be available for those who call in, we are able to do that. So we'll continue to make adjustments as we go, recognizing the importance of the phone line as a mechanism for people to register.
I just have one question. Business owners and brides who are saying, I'm not going to have my wedding here in Rhode Island. I'm not going to host an event here in Rhode Island. I'm going to move to, Connecticut and New York to do it. Massachusetts and New Jersey are probably going to be upping their limits as well using these rapid tests. Is there any update on this? Are we going to be able to increase gathering limits?
There is, yes. First of all, please note that in New York and Connecticut, they're predicting that they will open their guidelines, that they'll add flexibility in a month. Last week, we opened, for purposes of event professionals, the guidelines so that we could have events of any category up to 30 occurring now and through this month, and up to 50 participants in weddings. So we actually are ahead of those nearby states in opening up. We have had dialogue with event professionals and with venues of assembly, meaning auditoriums like this one and other arts centers. As recently as yesterday, Dr. Alexander Scott and I participated in an active discussion with event professionals and the Hospitality Association and with tourism representatives about what we can do to responsibly open into the future. So that's one of the areas where we're looking for flexibility. And let me also note there was a question earlier about, I think Jim was asking about, what else are we thinking about? What can we reopen? It was embedded in his questioning. And to both of your questions, we're looking at instances where in the medium and long term we can offer more flexibility. Event professionals is a key priority. We're also looking at residual aspects of the guidance that's been there since the early stages, things like cleaning surfaces, things like, some of that needs to continue to exist, by the way, things like the self-service soft drink decanters, things like whether haircutters, professional haircutters, can double book appointments, even if they keep their appointments very distanced, separate rooms with all kinds of sanitation and masking standards. We're relooking at all of that so that as the public health conditions hopefully remain strong, meaning remain favorable, we can look to those revisions, obviously all while tracking the strains and their emergence. And the last thing I want to say is there was a question, I think, Pat, about our governors. And I do want to add, on all of these points that I'm describing, Governor Raimondo is very much on the job and is very invested in governing as we roll out these changes. And Lieutenant Governor McKee is heavily engaged and is helping us consult stakeholders, make these decisions, and undertake these changes. So that process is working very, very well. Thank you again.